we need to have people have good mental health, or we can't prevent drug usage, we can't prevent homelessness. It's literally one of the most major funding blocks.
Welcome to The Force for Good. I'm Rick Gertsema, the Senior Mental Health Advisor for the Miller-Dwan Foundation and for Archimind. And I'm thrilled that we are in our new space. A shout out to Story North for getting us all set up again. We're now in our own office location, which has been wonderful. So I just have to walk across the hallway, and it's been really nice to have this brand new setup. It's very comfortable, and Story North has just done a great job of getting us all organized again. So we're anticipating monthly again for the podcast. And so for our very first episode, I'm thrilled that Ashlie Castaldo has agreed to be our guest. Ashlie is actually on our Miller-Dwan Board of Directors and has an incredible history in the city of Duluth, and for a person her age is involved in so many things. So first of all, welcome, Ashlie.
Welcome. Thank you, Rick.
I'm so happy that you're here. You bring this really nice energy just sitting in the same room with you, that contagious smile and that strong presence, and it's wonderful. I know a bit about you, and actually for our viewers, we really haven't gotten to know one another, except I certainly have read and heard and watched you. You're from Duluth.
Yes.
And you were also a candidate for the city council at-large position.
Yep, correct.
And it was so fun to watch that announcement on public television when you said, I am confident about being a candidate because you've asked me to be a candidate. It was like this really cool statement that I really loved. And so if you could just give our viewers an idea about who you are, all the things that you're involved in, kind of a bigger picture.
Sure.
And then we can go from that discussion.
Yeah, so that's kind of one of the questions I always tend to get within the community is, what do you do?
Yeah.
You're kind of everywhere, you're kind of doing some sort of thing. So what exactly is like the specific thing? Because everything I do is kind of generalized. But I'm a marketer by trade. As you mentioned before, Rick, I'm born and raised in Duluth. I lived a couple years in Illinois for college, but came back here because I was always passionate about raising my kid here and having the same upbringing, the same kind of community enrichment that I always had. Nice. And so it was really fantastic to be back here. We timed it right when COVID started. So It was very interesting dynamic to be seeing Duluth again with like new eyes, and it's very insular. And so that kind of shaped a little bit about where my community engagement fell after that, because that was kind of a big trigger for me. And so during that time, I got into marketing. I went to school actually for mental health.
Oh, you did?
Yeah, I went to school for psychopathology and behavioral health. My goal was to work for the FBI, actually. I want to work with very like unsavory characters. Yeah. And the interesting part is that when you do that, you kind of learn like what influences, how do you reach out to people, how do you connect in very unorthodox ways. And I've been able to take that into marketing. Just with having a young kid, marketing is a way more schedule-friendly option than working in mental health sometimes. But I've always been really passionate about mental health, especially as someone who grew up with an abusive home, and then someone who had a late autism diagnosis. There was a lot of mental wellness concerns in my upbringing. And I've saw it within my own family, seeing how that unhealthy dynamic can work, and when you have bad coping mechanisms, how that affects you. And so that passion is something that's really important for me right now, and that's a really big purpose that has guided me. But on top of that, I have all these things that I like to do, being community engaged, being influential in some aspects. So generally, I would describe myself as a commission member and influencer and marketer, and everything else is a CDFG after that. So
got it. And so when you thought about being part of the city council,
sure,
what were your hopes? What were you thinking your role could be that you could contribute?
I think for me, what I wanted to do is show a perspective that you can take these really technical, very mundane municipal issues and you can make them really empowering and you can make them speak to the social quality of every individual. And you can kind of make it so we really sort of invest in the people around us. And that's really where our wealth within the city of Duluth is the people. I really truly believe that. I don't believe it's even necessarily the Lake Spirit, which is beautiful, but I think it's really the community and how we interact with each other and how we view the world. And how can we take that infrastructure? How can we take those minute things and make it so they're life changing parts of who we are?
Sure.
And so taking all of that, like, and as someone who is very research focused, I want to be able to translate how do we take the wonky data in the policy and make it come to life in a way that speaks to everyone and not just a few.
You like to give voice.
Yeah. I like to help create narratives and echo them is really what I like to do.
Which is that whole then marketing background,
Yeah.
right? So thinking about what you've learned, what you gained while you were away, and then taking those gifts and really bringing them back home again.
Trying to, yeah, and as best way possible. I think a lot of people see city council as, this is we just meet once a week and we do very like basic things, but I think that city council, especially when you see who could be represented on there, speaks to really powerful things and can energize what we do, not just on a city council, but each of us individually.
So you're also a mom.
Yes, I have a fantastic 12-year-old son who is
12.
going on 30. He's taller than me now. He's has his own life, his social system, but I couldn't be more excited to be a mom, and I'm always proud of him every day. He does all the right things in my opinion. He's in Boy Scouts, so he's got a busy social calendar.
Yeah, yes. And so you also have been involved politically.
Yeah.
You're one of the people who was part of the national convention.
That's right, Democratic National Convention.
Okay, tell me a little bit about that experience.
That's I highly recommend if anyone can do that once in their life to go to some convention, Republican or Democrat.
Sure.
Just try it because it really does give you a good view of what kind of the system is and how it works. Because so I went there and a lot of it is training. So you go to different classes
Okay.
and hear about how the party itself or how different legislators are shaping policy and what the things that they're working on.
Yeah.
And so you get to see the actual congressmen and meet them. And one of the things that was most incredible was I actually went to the senior caucus and they talked about senior mental health and social security and really went in depth into it.
Wow.
And I didn't realize how much social security actually buoys our local government and how much it actually funds communities.
Okay.
And then we went to like a military caucus and to see how they actually shape like a military spousal support program or how much paper goes into just changing a new lock on an infantry hub
Sure.
door.
Sure.
All those things, like it takes like multiple people, governmental actions just to get a door fixed
Yeah.
at a military base is
Wow.
just it really was incredible, and you get to feel like you're part of something and you get to interact with all these people from all walks of life. I mean, I spent a lot of time with a couple people in Alaska, Texas, and really down south good home people, and you get to see how common we are and how much we can connect. We're much more alike than we are different.
Oh, I love that saying.
So
I love that saying.
it's really true. I
Yeah.
mean, as far as I'm concerned, Texans can be invited in Duluth anytime they want to. They love the exact same things we do.
So where did you actually go and for how many days?
So we were in Chicago and we were for 5 days total
Oh,
for the
okay.
DNC. They have a theme night every night and they have some sort of educational goal essentially every day.
Okay.
So you're going from like almost sun up to sundown. I mean, we were getting back to the hotel roughly around like 1 a.m. because of how much security and transportation is. And it's a whole process, but
Yeah.
I wouldn't trade it. I mean, I was very sleep deprived and I got COVID right after it, but it was well worth the souvenir. So
So that's really kind of a great big picture and all of these incredible experiences that you've had
yeah,
it very early in your life, actually. Somebody my age to somebody your age, you've done a lot. So now that we have some context of that bigger picture. How about the world of mental health?
Sure.
And you talk about mental health and your advocacy for mental health. Can you talk a little bit more about that and even anything that you'd want to share about your own journey?
Absolutely. Yeah, I think when people view as one of the like key health goals or key social things to focus on, I always say mental health is pretty much the most top of mind issue. If
Sure.
you don't have your mind and your soul like in line, it's very hard to focus on the other areas of your life. You find that it's impossible to go to your job, it's impossible to connect with your family, it's possible to take care of even your own body if you can't take care of your mind. And on top of that, like on a just a large scale structural perspective, we need to have people have good mental health, or we can't prevent drug usage. We can't prevent homelessness. It's literally one of the most major funding blocks, and it has.
Absolutely.
If you invest in it, everything else kind of falls into place, and your preventive care always wins over defensive care, in my opinion.
Yep.
And I've definitely seen that in my own life. Growing up as someone within mental health concerns, I've had like major depressive
Yep.
problems.
Yep.
I even actually stayed at a stint at Miller-Dwan.
Okay.
So I've been able to see patient board member and how that works out. But I grew up in a family where the idea was, well, we're just sad people. We're always
Okay.
going to be sad. It's never going to change. And there
This is
was
status quo.
yeah, this is why would anything be different for us? So there was no idea that you should go out and take care of yourself, or you should focus on it. And then another half of my family viewed it very much in a spiritual lens, where they viewed it as it's almost sinful to be facing mental health. It must be something where you have created separation with God.
Okay, sure.
So it's the only way to resolve it is to get more spiritual, and then eventually God comes in and solves it.
Yeah.
Well, the problem is if it's something that you're regularly chronically occurring with, it's
Right.
you can go to God as many times as you want to, and even at my most depressed moments, I felt like I was at my closest to God in my faith,
Yep.
but there was nothing there, and so it actively harms your faith and your spiritual and your mental health
Sure.
as you're progressively not dealing with it.
Absolutely.
Um,
Absolutely.
and so that's one of the things I credit is Miller-Dwan like really saved my life and helped me really kind of refocus it. I had to make a decision and say, I understand what I've been taught. It's not working, and what I was doesn't have to be who I am. And so using those coping mechanisms and like making that a priority like became something that I was like laser focused on, and being able to see night and day of what life can be like, and that you don't have to always be just surviving was something that I was really passionate about to help be an advocate for.
That is so commendable. Wow.
Thank you.
And so we talked earlier about it doesn't need to be this extreme or this extreme, which is really the same approach that you take with mental health, because growing up
Yeah.
it was, well, we're sad, so we're just going to be sad, and that's the way life is going to be.
Yeah.
Or you need to do this way over here, and that's going to be the answer. And so you were willing and strong enough, and tenacious is the word that keeps popping into my head right now, um, and strong enough to say, there's got to be something in the middle. There's got to be something that I can do for me, because these two things simply don't work.
Yeah, absolutely. I think especially if you grow up in an abusive home, or a home where you're even if you're in the rat race of like the market, you view this thing where nothing's happening unless there's chaos, or there's something dramatic, or there's some extreme,
Sure.
and that's your baseline.
Yep.
The problem is that you should probably be going for peaceful rather than happy sometimes within your mental health journey.
Yes.
Sometimes we overextend our definition of what happy is as being over the top, or and an extreme is the
Totally.
closest view to it.
Totally.
Sometimes it's okay to be we can be nuanced. This is a good time. Not everything has to be an immediate decisive action, and that's kind of the big takeaway that I take is sometimes wholeness and peace is just a small step. It's sometimes just not having something be pushing forward.
Exactly.
So yeah, I like trying to be as much as we can to be in the middle and united, and that's kind of where I view it.
Yeah. And actually, likely the way that you live your life. certainly the way you've lived your public life.
Yeah,
And now it sounds like it really is the way that you live your life, your private and personal life.
I try doing the best. Obviously, there's days where everyone falters, but I know for myself, and part of this is also having a late diagnosis with autism.
Yeah.
Is there was a perception of why are things failing, and then sometimes I had to come to terms with maybe it's not me, maybe it's just maybe I'm not the tools that I'm using. Maybe it could be something external.
Something different.
But for me this year, like I've tried to work really hard on being as mentally well and whole as possible, and that had to come to me accepting sometimes um, it's okay to just be okay with what I'm doing and let the perception
Right.
be perception. So all I have to do is if I can look at my kid in the face and feel like I'm doing a good step that day or moving forward, I feel like I've won that day.
Nice. And actually it's winning in that relationship, right?
Absolutely.
Because you're present and you have a really good sense of being present. It seems like if you're in, you're all in.
Oh yeah,
Right.
I can. It takes a while for me to be convinced, and I don't give like all of myself until the end. Like I try and have to make it worth it. But once I'm in, like you will never have to doubt. I am 100% all in. It's
Yeah.
not a a halfsy thing. It's we're gonna do it.
Yes. And you're also one of those people who is willing and freely will share your perceptions,
Yeah.
right? Which I think is also part of self-care. It's also part of being part of community. And it seems like you really have been in a number of places in which you've been able to do that.
Well, I think, if you want to be someone who values being heard or other people being heard, you have to have that reciprocity. Like, you have to say, I trust my community to hear what I'm saying, so I'm going to be willing to step up and be honest. But in return, you have to be really open with vulnerability of other people and create safe spaces. I say this with other people involved in, the public spirit. If you want to be the change leader, if you want a dish, you got to take it. There's everyone has a piece of the pie, and so you have to make sure that everyone gets to kind of have their space in there.
Yeah.
And I know for myself, like I like to be someone who said, okay, I'm going to give you a part of me so you can connect with and we can have something to relate on.
Hmm.
But I really, really love hearing more about you. So if I can like break the ice first, I will, but I would love to hear what you're doing
Nice.
to help me. Yeah.
So with all of that, here's Ashley.
Yeah.
And then you're approached by Tracy Marciniak, our president,
Yeah.
who asks you about the Miller-Dwan Foundation Board of Directors. And you said yes.
Absolutely. Yeah.
And it was, that's my understanding. It was absolutely. So why absolutely? And why the Miller-Dwan Foundation Board?
There's kind of three separate ways. First of all, I've always had this perception that with the Miller-Dwan Foundation and board in general, that it was like very corporate, very much like there was no way I would ever be asked to serve on a board of that level. Like
Yep.
this is, stock investors. This is like shareholders. This would not be, if someone saw me, they would like, that's not really her scene.
Yeah.
And I was like, if they want me, this must mean that like they are really willing to do something outside of bounds and take a risk. Like this might be
Ah.
a space where we could have a different change in voice. And if there's a space for risk takers, I really want to be in on that.
Shocker.
Yeah, exactly. And Tracy is just so warm and she's so inviting. The fact that to have her as like the lead person come to me, I was like, this is good. This is going to be a vision that I want to be in. And the way she sells things is just, it's so fantastic. I was like, this is something I'm going to be passionate about. I'm going to be all in. But I also viewed it as something that, as someone who has utilized the services of Miller-Dwan,
Exactly.
what a great way for me to give back and show thanks in a way. I mean, I had a fantastic experience as a patient. I felt like I really got what I needed.
Yeah.
And so if there's a way that I could help give anything as someone who has received that,
Yeah.
even just sharing my story, I would have absolutely been willing to do that.
Yeah.
So that was a key thing for me. And then just seeing, the tours and seeing all the services, seeing how directly Miller-Dwan is affecting the community, I was all in.
Nice. Nice. And in your experience so far as being a board member, corporate, not corporate, you can contribute. What would you like to contribute? If somebody said to you, "You think I could be on a part of that Miller-Dwan Foundation board of directors?" What would you say to them?
I would say it's corporate in the sense that it's really streamlined and everything is like very technical. Like everyone brings a great budget. There's good, like high level information that's being brought to the meetings.
Yep.
I would definitely say if they were interested, they should absolutely consider joining and inquire about it. I think there's a really good space to have different voices. I don't feel insecure about contributing, even with my lack of experience on the board.
Sure.
I feel like I've been welcome, and I feel that people really respect what I give back, and in turn, I really enjoy what people bring back to the table when we have our meetings.
Yeah.
And I really like that kind of those check-ins and the ways that we work to train each other when we're having meetings. So I would absolutely, I highly recommend it, and I've had nothing but good experiences.
And if you look as a board member and you think about the future direction and the work that we've been doing with Archimind and the work that we've been doing with Problem Management Plus, that we commonly refer to as PM Plus, which is the global intervention that we're bringing into the United States. Looking forward, where would you see your role or your contribution or your excitement in future thinking? Because I think you're also a future thinker.
Definitely. I see like two strains of where I would view being the most involved in it or
Yeah.
that I'm most excited about. One, PM Plus, I think it's going to be absolutely radically changing for a community. I can already sense that there's a big excitement for it. I think being able to be a solid voice and to help promote that is going to be really key. And I've actually had conversations this week with three different people who've mentioned it,
Nice.
being involved in some way. So I can see in my own life how people are being changed by it.
Yeah.
And being able to take that and show how it shapes stories, I think is going to be fantastic. But also, I think even just on a more informal basis, just lobbying for the organization,
Oh,
um,
sure.
I've been able to help promote, especially St. Paul when we talk about how critical community mental health is. Bring up Miller-Dwan, what we do, PM Plus. I think there's a way we can translate different avenues of support, and I'd love to be on ground level for that.
And that whole idea of policy,
Yeah.
I think it's probably an area in which people back up or shy away because to me that sounds daunting. If I think about policymakers and policy change and thinking about conversations with congressmen and those kind of arenas, it's like, yeah, that's not a thing for me. There's some part of that that comes naturally to you or is an okay thing for you to do.
Yeah, and I totally get where people have that stereotype because when we especially see on television like policymakers, like
Yeah.
politicians, it's very stuffy. There's a
Yeah.
very like back room, like we tighten our tie perspective of it.
Exactly.
Um, I tell people almost everything you need to learn socially, you could learn in high school or college, as far as how to develop that networking.
Okay.
It's because even like going to when I've to made trips to St. Paul or at DNC, everyone kind of is deep down inside a really insecure teenager just hoping to get accepted. We're
Okay.
just in suits.
Oh, got it.
So if you can find a thing to connect with it, like I make sure to go to people and I say, hey, I really like this thing you're doing, or I like what you brought to the table there, and they go, oh, that's great, and immediately there's something for us to like kind of open the door. Trying to make some sort of welcoming moment and then progress from there doesn't feel as hard for me as it used to.
Okay.
But I also I totally understand that feeling of not being totally confident in certain areas because
Sure.
it's a very weird mental adjustment that you have to make usually in those services. It's especially if you find like yourself being socially anxious,
Oh,
that can be a space. But I like it though, and I like the idea that we can, make a more relaxed environment or have things that we can connect and find new ways to frame issues that are affecting us.
kindness and connection are
That
two things that just sort of resonate.
I try. I always, if there's one word, I would say welcoming. Is there a way we can make people
Welcome.
feel as comfortable and entered into the room as possible. Once we get people there, it makes things easier, but we have to make people feel like they deserve to be in the room, and that's really the big challenge.
Which sounds like even what you want to bring and have been bringing to the Miller-Dwan Foundation board.
Well, I appreciate that. That's my hope, and I hope that that's seen there.
and intentionally walking into a room and understanding that my presence here is welcoming, and it aligns so well with the work that we do as a foundation, and it also fits beautifully as we think about the launch of Archimind and having a global institute and thinking, well, we're just Duluth, Minnesota, and can we really be a global institute? And can we really be an Archimind and be the place? And I think with the same presence and the same thought about welcoming, be a part of this space. And you also have something that we really have come into probably in the last year, is the whole idea of, why not? Someone's got to do it.
Yeah, I mean, there's obviously, we have a world that is really tumultuous right now. Like, why not step up to the plate? There's very little risk to not doing something good at this point.
Exactly.
And that's really, as you mentioned that, Rick, that's one of the things that I really, really am so excited about working with a Miller board member
Yeah.
is, going back to it is, Miller-Dwan gets to be the voice to say, you deserve to be in this world. You're welcome to be in this world. These are the tools that we have
Yes.
that are helping make that possible.
Yeah.
And so that's something I'm so excited about, and I love what you guys do with all those programs.
And that you're comfortable. We talk about what's our local impact, what's our regional impact, what's our statewide impact,
Yeah,
and then what's our global impact. And being a part of all of that with what you bring and your skill set and your willingness to be a part of that, welcome
totally.
into this space, because this is the work we want to do, and not in any self-righteous or pretentious sort of way. Be in a relationship, invite people in, and even spending just this much time with you, you exude that. Your smile is incredibly contagious. Your
Thank you.
energy is contagious. I think you bring something very unique, and the more that we have those unique perspectives. So on behalf of the Miller-Dwan Foundation, of course, we're thrilled that you said yes. We're thrilled with the gifts that you bring, and even bold enough to say, sure, I'll do a podcast. Why not? Right?
Hey, life is short. Let's put in as many interesting experiences as we can in it while we're here.
I love it. Thanks so much for your time today.
Thank you so much, Rick.
Yeah. That'll do it for this episode of The Force for Good. And of course, we're always going to ask, and please be a part of joining us in being a part of The Force for Good. Thanks.